signing in, and we'll get started. Thank you for joining the webinar. We're really excited to share with you just some general information about our suicide prevention initiative and the Zero Suicide Academies that will be coming up. Next slide, please. We know that suicide is all too common occurrence in the United States and our state. Each year, Ohio loses between 1,200 and 1,500 of our citizens. And the cause of suicide and suicide attempts are complicated and diverse, both in those who attempt to take their lives and in society as a whole. And we know there's many proven actions that can prevent suicide, and we really want to be able to increase the frequency these actions are implemented. Understanding the data behind the deaths due to suicide can help us appropriately target actions to save lives. And even modest reductions in the suicide rate in Ohio, we hope will result in hundreds of saved lives and thousands of years of productive lives in those saved each year. Next slide, please. In 2016 and the 2017 state budget, the department was allocated funding to address reducing suicide in Ohio. To our knowledge, we're only one of 5 states to specifically allocate funding for suicide prevention. And by identifying suicide prevention as a major public health issue and disseminating strategies demonstrated to decrease suicide, we really have the opportunity to save lives and have fewer families, friends, schoolmates, and other loved ones impacted by this tragic event. We believe Ohio must adopt a data-driven, comprehensive public health approach to preventing suicides and ensure that all Ohioans have access to effective, high-quality suicide prevention, intervention, treatment, and recovery support services. And we know this is a massive undertaking that we must approach methodically and logically using the best information available to all of us. And Ohio recognizes the quality of work that is already taking place and the need to capitalize on that work by relying on the Ohio experts that exist to reach the goal of suicide being a, quote, never event in our state. Next slide, please. Next slide, please. So I'm going to keep talking, and the slides hopefully will catch up. So we're going to focus on evidence-based practices, policies, and procedures to enhance the suicide prevention infrastructure in Ohio and build the capacity of our behavioral and primary health care workforce for maximum impact across the continuum of care and the lifespan of all Ohioans. We're going to be looking at capacity building, workforce development, stigma reduction, helplines, which would include crisis text lines, and further support of stakeholder-led coordinated suicide prevention efforts. Next slide, please. In regards to capacity building and workforce development, the department is engaging in a needs assessment and gap analysis. The information compiled from this analysis will be presented to state and local stakeholders to help develop long-term strategies in reducing Ohio's suicide rate. It is the hope that the needs assessment and gap analysis will inform future workforce development needs, as well as support for specific evidence-based practices. We will also support opportunities for communities and clinical care settings to receive training and technical assistance on suicide prevention, evidence-based practices, again, that have demonstrated a high return on investment and or significant outcomes through either national or local evaluations. These evidence-based practice trainings will focus on primary prevention interventions and clinical care evidence-based practices that include interventions and treatment that are designed to target suicide risk directly and targeting and treating suicidal thoughts and behaviors. And the core of all of this and the heart of all of this is the zero suicide approach. Next slide, please. So zero suicide is a key concept of the 2012 National Strategy for Suicide Prevention. It's a priority of the National Alliance for Suicide Prevention and a project of the Suicide Prevention Resource Center. The foundational belief of zero suicide is that suicide deaths for individuals under care within health and behavioral health systems are preventable. Next slide, please. So the zero suicide approach for behavioral and healthcare systems represents a commitment to patient safety, which is the most fundamental responsibility of healthcare, and to the safety and support of the clinical staff who do the demanding work of treating and supporting suicidal patients, the boots on the ground. Next slide, please. So because of this, the department will be sponsoring a series of zero suicide trainings in collaboration with the Suicide Prevention Resource Center for our clinical care providers in behavioral health and primary care settings. And we're also offering this to our federally qualified health centers. And we believe training clinical and primary health providers in the zero suicide approach will allow for a much broader impact and lead to the systemic change. Next slide, please. According to Julia Goldstein-Grummett, Director of Prevention and Practice at the Suicide Prevention Resource Center, the zero suicide trainings grew out of rising interest by healthcare organizations to learn how to better provide care for those at risk of suicide. And the framework provides health and behavioral health organizations ways to improve care for those who may be struggling with suicidal ideation. Next slide, please. One more slide, please. Zero suicide trainings will be two-day trainings conducted by SPRC for senior leaders of our healthcare and behavioral health organizations who are seeking to reduce suicide among clients in their care. The trainings will provide information to participants on how to incorporate best and promising practices into their organizations and processes in order to improve care and safety for clients at risk of suicide. The trainings will be very interactive. They will include presentations, small group sessions, and the faculty from SPRC will collaborate directly with the participants to assist in the development of their specific zero suicide plans. And there are 7 characteristics, or components, I should say, of zero suicide. We want to lead. Lead is one of the core components. Organizations and leadership must make an explicit commitment to reduce suicide deaths. Identify every person at risk for suicide. We want to make sure every new and existing client is screened and assessed for suicidal thoughts and behaviors. Engage clients in a suicide management plan and make a commitment to follow closely at-risk individuals for suicide by engaging and re-engaging them at every visit. Treat suicidal thoughts and behaviors directly and choose evidence-based treatments that focus on suicide risk to keep patients safe and help them thrive. Transition. Follow patients through transition care. Put policies into action that ensure safe handoffs among caregivers within the organization and upon discharge. And finally, improve. Apply data-driven quality improvement. Use data to inform systems change that will lead to improved client outcomes and better care for those at risk. Next slide, please. And again, this is going to be for senior leaders of healthcare, looking at incorporating best practices and promising practices, very interactive process, and lots of hands-on work with our national experts. Next slide, please. So as of now, We have 2 confirmed dates of the first 2 academies, the first being April 12th and 13th, which will cover the Heartland and Appalachian Behavioral Healthcare region. The second academy, scheduled for May 10th and 11th, will target organizations within the Summit Behavioral Healthcare regions. And the other dates are still to be determined. We are looking at to hold 2 academies in September and 2 of February in 2017. And note that at each academy there will be slots for our state hospitals. Next slide, please. So again, we're targeting behavioral health care providers, primary care, FQHCs. Each organization can bring between 3 to 5 team members. And we know that Dr. Mike Hogan will be participating in at least the first academy and maybe some of the other ones. Once we have a full list of presenters, we will share those as well. Next slide, please. So the eligibility process, there will be an application for each academy. We are hoping to have the April application out by the end of this week or the beginning of next week. There's still some few internal issues we're wrapping up, so we hope to get that out quickly. But part of that process, there will be a cover sheet that will have to be completed. Letters of commitment from your organization's CEO or director are required. There will be a 1-page abstract and narrative page. The application will provide guidance and have questions that you will answer to make it pretty easy to get through that process. And then you must complete the Zero Suicide self-study, which is located on the Zero Suicide website. Those are the critical pieces that must be provided when the application is submitted. Preference will be given to those organizations that serve clients in the areas of high risk and those within the behavioral healthcare regions that you're applying for. There will be implementation stipends provided to organizations who are selected. And the organizations that are selected must participate in a 9-month learning community after the completion of the academy. Next slide, please. So a little bit about the learning communities. So following the first series of academies, the department will support the learning communities infrastructure with guidance from the Suicide Prevention Resource Center. This infrastructure will be developed to support organizations in the implementation of the zero suicide plans that they develop, and it will allow for interaction with other organizations to share experiences and further develop knowledge, skills, and abilities to sustain efforts across Ohio. Through this, our hope is that we're able to identify some zero suicide mentors and be able to provide opportunities to expand and support zero suicide efforts across the state. So you can see that the learning community will be over a 9-month period. It will be phone call based. There may be some work in between each learning collaborative. We'll find out more of those details as we move forward. But we think that will be a really critical component to the sustainability of the work. So that's a basic overview of where we're at. So if you have questions, our partners at Drug Free Action Alliance are going to share those questions, and we'll try to get some of those answered. CAMS training is being offered in partnership with the Ohio Suicide Prevention Foundation, so we hope to get more CAMS trainings out there through their Garrett Lee Smith grant, and it's definitely one of the ones that we want to support. That's a really good question about this being open up to the prison system. I think the first go-around of this, it will be focused for the community-based efforts. I think that's a really good area to explore. And I will take that question back to leadership, to Dr. Hurst and our internal team, and respond to that in more detail. Are there any other questions at this time? My email address is there at the end of the slide. I am open to questions. If you think of something after this or as the applications come out, feel free to contact me anytime. Yes, this is open to agencies working with youth. I think the involvement of schools would be dependent on the organization that's applying. If they identify school personnel as critical team members to addressing or implementing zero suicide within their organization, they could most definitely ask community members to be part of their zero suicide team. Same with if you're a paraprofessional survivor, part of a loss team. We really want to emphasize the importance of having members of your team be those with lived experience. So they are great assets to the team. So if your organization is able to identify folks in those capacities, that would be fantastic. I know there's been some conversations with the Board Association informing them of this work. Our hope is that organizations and boards will also communicate and decide what steps to take, what organizations are most ready for this work. And we're also working with the Suicide Prevention Foundation in hopes that this information also gets to the coalition. The stipends are going to be $8,000 per organization, and our partners at Drug Free Action Alliance will be handling all the logistics for the academies as well as the stipends. So once applications are submitted and are selected, Drug Free Action Alliance will be reaching out to organize the stipends with your organization. Any other questions? This time around, the trainings need to be a mental health substance abuse treatment agency or FQHC. I think we'll learn about the data collection as we move through the training academies and the learning collaboratives. That's part of the component of the academies that they will teach us on what we'll need to look at beyond the academies and beyond the learning communities. Any further questions? Okay, well, if that's all the questions for today, again, feel free to reach out to me, shoot me an email. I'm happy to answer any questions, any clarifications that you all may need. And we really appreciate you taking your time out today and look forward to seeing all of you, hopefully, at the upcoming academies. So thanks and have a great day.